From the Skyterra Wellness Retreat, this is the Inspired Intentions Podcast, where we help people build the skills and mindset to live a healthy life. Hey everyone, before we dive into today's episode, if you've been enjoying our podcast, take a moment to rate and review. It may seem like a small thing, but our ratings and reviews make a huge difference in the quality of our show. They help us reach more listeners like you so we can continue bringing you more amazing content. So, if you found inspiration, learned something new, or just love tuning in every week, please rate the Inspired Intentions Podcast 5 stars and leave us a review and even share with a friend. We truly appreciate each and every one of you. Now let's get into the show. Inspired Intentions listeners, welcome back to another episode. We have today a topic that I find quite interesting. I have experienced it, and I'm very curious to learn more because I walked away from my experience wanting to know more. We have none other than Dr. Becky in the Skyterra booth with me today, a first-time podcaster, and Dr. Becky is here to talk all about dry needling. You know, what and why do you dry needle? How does it work? What benefits are there? We're going to go over all this stuff. Dr. Becky, welcome.
Thank you, Alan. Thanks so much for having me today.
Yeah, absolutely. I'm excited to talk about this topic. Like I was mentioning, I've had dry needling done once, and I walked away from the experience honestly still wanting to know more. So I have some questions for you, and I'm very curious to hear your answers.
Great. I'm ready to answer all your questions.
Awesome. Well, actually, oddly enough, I was watching football last night, and I was Monday Night Football, and I was listening to an interview from a high-end running back in the NFL, and he was talking about all the things that he spends money on to keep his body healthy, from chambers that infuse oxygen into the muscles, massage, and one of his things that he consistently does is dry needling.
Therapeutic dry needling is a great place to spend your hard-earned dollars. Because if we don't feel good, not much else matters.
Yeah, that's fair. I mean, you know, it was Derrick Henry. He's a high-performance athlete, and it was really interesting listening to him talk about that and his experience. So, yeah, I'm super excited to dive in. But before we do, why don't you tell the listeners a little bit about yourself?
Sure. I'm Dr. Becky Davidson. I'm the physical therapist here at Skyterra Wellness Retreat. I have lots of experience. I'm also a board-certified orthopedic specialist, and I've been doing dry needling for over 10 years in my practice. Long time.
So would you say that dry needling is something that's fairly new on the landscape, or has it been around a really long time?
It is fairly new. Not all PTs do dry needling.
Gotcha.
And PTAs cannot do it. It requires postgraduate training.
Understood. Well, why don't you give the listeners, for those that have absolutely no idea what we're talking about, what dry needling is, give them like the 10,000-foot version of it.
Okay. Dry needling is the insertion of a needle. It's actually an acupuncture needle.
Okay.
But this is not acupuncture. It's different. You insert that needle into a muscle knot, which is a tight spot in a muscle. A pistoning effect is used, and then the needle is quickly removed.
How quickly from like insertion to removal?
It's just several seconds.
Gotcha.
So you are not leaving the needles in the body.
Okay. What brought this onto the landscape?
Sure. The National Institutes of Health has done some great studies, and what they were finding was that it appeared to be the insertion of needles into muscles rather than actual medication that was helping alleviate symptoms of pain and tightness. And so why put a chemical in the body to help if you don't really need the chemical, if the action of the needle itself is therapeutic? That is how dry needling was born.
Interesting. So were they inserting it? You're talking about like muscular knots. Was it like somebody was sore? They're like an injury in a muscular area that they were inserting the needle?
Well, both of those
Okay.
situations are appropriate for dry needling. Any place in the body where there is a muscle or myofascial tissue, and myofascial tissue is a connective tissue in our body. It's throughout our muscles, and sometimes those terms can be used interchangeably when we're talking about trigger points. A trigger point is that knot that you might
Yeah.
have as a result of an injury or just plain old tightness. So it's appropriate for both, to answer your question. And so dry needling is used in many, many different circumstances, but it has to do with our muscular system.
Understood. So like when one of our guests come to you and they ask about it, they're curious about it, or they have no idea and you say, maybe this can help you, what type of things are they coming to you with? Is it typically just that like sore muscle, or is it more so, do you see more injuries that people are looking to have worked on?
It's a variety of things.
Okay.
Most people, if we were to stand at the side of the road and have everyone come out of their cars and we started feeling like their neck area, and when I use the word palpation, that means that's a clinical term for feeling with your hands, the body.
Yeah.
Okay. And so these trigger points at the hands of a trained practitioner like myself, they're very easy to palpate on a person's body.
Okay.
And it's for a variety of reasons. Maybe somebody doesn't exercise enough. Maybe someone has over-exercised.
Okay.
Perhaps someone has, turned their ankle walking on uneven terrain, or pulled a hamstring diving for a pickleball. There's all different ways that these present themselves, that trigger points present themselves. Poor posture is a really common one. And
interesting.
Think about all the screen time, and people work really hard, right, throughout during their lifetime. And think of all of the things that put us on a computer or on our phone or on a tablet. And that forward head posture causes a lot of trigger points in the neck and upper back area.
I'm straightening my neck out while you're talking. You see me doing it, I'm like slowly creeping backwards. Yeah, I spend a lot of time over a computer. I get it.
Yeah.
So with these things that people are coming to you with, whenever you're like, I think you could benefit from dry needling, this is just curiosity. Are people like, yeah, no, I don't want that? Do you think that most people are really susceptible to be like, yeah, I'll try that if you think it'll help?
Okay. I have done dry needling on, thousands of times, at this point in my career. And very seldom is someone not interested. Occasionally, a person will say, I hate needles. I have a phobia of needles. And guess what? I go on to a different treatment. Dry needling is only one of the therapeutic tools that I use in my practice, but it's a very important one because we can get pretty quick results. And this type of treatment goes straight to the heart of the matter.
Have you ever met somebody that just is like, I love needles?
Yes.
Have you? I didn't think that was a thing.
Yes. And let me give you some context for that.
Okay.
People who say that are people who have had past experience with dry needling.
Oh, okay.
And it was such a great experience that they're like, yay, I'm so happy
They're back.
I'm so happy you do this. Let's get to it.
Yeah. Understood. I was expecting you to say no, but that makes a lot of sense. That makes a lot of sense. So that's anything else that you see that the guests are coming to you with that specifically might resonate with some of our listeners that you think dry needling can be beneficial for?
Yes. A lot of people have long-term problems. They may be bringing up back pain that they've had for 10, 12, 20 years. And dry needling can help those problems as well. Another problem, a lot of people have TMD. You've heard of TMJ.
I have.
TMJ is a temporal mandibular joint. Nowadays, to cover problems in the head, neck, and facial region, we use the umbrella term TMD, temporal mandibular disorder, because it covers more things. Everyone has a TMJ. So to say that I have TMJ, technically, that's not the best way to term it. But there are so many people that have experienced facial pain or even dental pain. And there is a little muscle between your upper and lower jaw called the lateral pterygoid. It's hooked to a little articular disc with that joint. Dry needling is extremely effective for problems in that area.
Interesting.
Because that little muscle cannot easily be reached by palpation. You
Sure.
know, years ago we were using a gloved hand in people's mouths, to try to like massage that
interesting.
area. Well, that's not great, right? Not very comfortable to have someone's hand in your mouth. The needling works beautifully and get wonderful results with that. So, and often that might be with guests, that might be kind of an aside when I'm reviewing their medical history. They might kind of casually mention, well, occasionally my jaw locks up, or I grind my teeth or whatnot, and I'm like, we can cover that too.
Interesting.
I try to cover everything that I can in that session. In that service with guests.
This is just another curiosity. Migraines?
Yes.
Oh, really?
That can be really useful with dry needling. In the case of migraines, I'm often dry needling in the upper cervical area, which is the upper part of your neck, like where your spine it attaches to your skull area. Typically with migraines, we'll do dry needling in that area. Also in the temporalis muscles, which you have on either side of your like forehead area, and the frontalis muscle, which is the muscle across your forehead. Very effective.
We might have to talk afterwards.
Hey,
I personally get migraines, and they usually start in that area that you're describing, either left or right-hand side of my spine, right where it meets the back of my head. And then I feel it creep up, like the migraine starts down there, and that's the focus of the pain, and then it creeps up over into the skull, kind of like almost behind my eye, and it kind of wraps around. And I've heard that pretty commonly. Some people call it a tension migraine.
Yes.
A couple of doctors I've talked to have said that, but I've never heard anybody suggest dry needling as a fix for that. It's always, this medication or this medication, whatever that is.
Right. I would love to work with you on that particular challenge that you're having. Often people will describe like they feel like their head is in a vice.
Oh, yeah.
And you don't have muscles on the top of your head, but you have myofascial tissue.
Sure.
I mentioned that word earlier. That could be a whole nother podcast, okay? Because that is a topic that a lot of people are unfamiliar with. But that myofascial tissue, it basically fades in with your muscles. So if you've got tightness in your muscles, in your neck and face, it's going to cause tightness in that myofascial tissue over your skull area.
Makes sense. So you see all these problems that folks come in with, guests come to you with, and you make the suggestion of dry needling. A guest agrees, and they're like, yeah, let's give it a try. I want to know more of the technical side behind it. How does it actually work? From the moment that needle hits the muscular group and it goes in, how does that actually work?
Evidence-based research tells us that it works two ways.
Okay.
There's a mechanical action and a chemical.
Interesting.
By mechanical, what I'm talking about is the actual insertion of the needle into that tight knot. It actually helps loosen that knot.
Okay.
In muscles on a microscopic level, you have something called actin and myosin bridges, and it actually helps release those.
Okay.
The second way is chemical. They found that where that needle inserts, it helps dissipate inflammatory chemicals that your own body produces, such as bradykinin.
Okay. So as far as how deep the needle has to go in, is it very dependent on what muscle group you're entering in?
Yes, and the size of a person's body, right?
Yeah.
So yes, and I have all different sizes of needles. For example, in the facial area, you just need a teeny tiny needle for that area. Those tissues are very thin. Same thing in the hands or in a lot of the feet area. Whereas if you're doing somebody's glutes, these are the muscles that give curvature like to the buttock area.
Yeah.
Those are very thick muscles. So
Yeah.
I'm using a much larger needle for those areas.
Gotcha. Describe because you have a couple of them sitting right here, right?
Right.
Describe the needle to me,
Sure.
or to our listeners.
I brought this just to show
Can I
you.
see one of them?
Sure. Yeah. Here you go. Because I wasn't sure what your previous experience was with this, but you're going to notice, first of all, these are sterile.
Yeah.
These are in sealed individual packages, and we use what's called a clean technique. I always have on gloves. The body area is alcoholed off, before and after the insertion and removal of the needle. But if you kind of tap your fingernail against this packaging, it's going to feel very firm, okay? Because there is a plastic tube in there.
Gotcha.
It's hard to actually see in the packaging.
It really is, listener. Like, this needle is so thin. It is, honestly, I have to hold it a couple inches from my face, and I have pretty good vision. It's hard to see.
And I use needles smaller than this. I will tell you, listeners, I always use the smallest gauge needle that is going to be effective because I do not believe in inflicting pain in any way on, people that I'm working with. And so I try to make this whole process as comfortable as possible. But you've got this plastic tube covering the actual needle. The reason for that is these needles are so fine. If I had an unsheathed needle and I went to stick it in, it would bend. It's too fine. So I actually place the insertion tube against the guest skin, over the muscle area and myofascial area that we're going to use. And then I tap the needle through with my fingertip. And often what people mostly feel is the insertion tube. That's not going in their body. It's just resting.
Yeah.
It is just resting on top of their skin. And they don't even realize that I've tapped the needle in and removed the tube.
Yeah, this thing is so small. Would you consider this to be like, what gauge is this? Is this like medium size?
The print is so small on this. I took it out of the box before I didn't bring the box with me. The box is down in my treatment room. I would have to look at the actual box that this came in, but they're really small.
Yeah.
Like Alan mentioned, you can barely see it looking at the packaging.
Yeah.
And that's what helps make this technique mostly comfortable for people. But I certainly respect if someone is just like, nope, there's plenty of other things that we can use. But I mean, I can only think off the top of my head of like 2 people out of, like I said, I've done this thousands of times that were like, no, I don't even want to give it a try.
Yeah.
And I have never had anyone who we've started this technique that has refused it, that have said nope. But I try to make it as comfortable and as effective as possible.
Yeah. So let's go back to like the actual process. So you take one of these, tap it in as you're describing. How many do you use? Is it just one at a time? I mean, how many needles are you using in let's say like a particular muscle group like the glute versus like somebody's neck?
Right. Okay. As far as it varies because remember, Alan, I said I'm not leaving them in.
Right.
In acupuncture, the needles are left in, and a guest would typically recline on a table for a period of time. In the instance with physical therapy, it is active treatment the entire time. I'm never leaving a guest with needles in them. So I'm using a pistoning effect, and I'm going to various trigger points within a muscle. Typically, there's multiple trigger points. Some of them are active, which means they're hurting you now.
Yeah.
Some of them are latent. These are trigger points that I can palpate, but that don't hurt you, or you don't feel it until I'm pressing on it.
Sure.
But let's address those too, because they're just like lurking in the shadows, okay? Waiting to pop up at any time. And that might be as a result of, various things. Maybe you're fighting a virus, or you haven't gotten enough sleep, or you're under a tremendous amount of life stress. All of those things, in addition to the other things I mentioned previously, do contribute to trigger point formation.
When the needle is inserted mechanically, do you typically feel more tension in the muscle and then it releases once the needle is removed? Is that?
At times, occasionally you'll get what we call a twitch response.
Yeah.
And this is when it's almost like the muscle grabs around the needle. It's very brief. I mean, we're talking just really brief.
That's what I experienced.
Okay.
For sure. Because I had, on my IT band, I had dry needling done on that. And that was my experience, which I'm sure is probably pretty common for an IT band, right? It's usually pretty tense.
It is. And the IT band is a great body part, right, to needle, especially in people who are really active.
Yeah.
Runners tend to love having their IT bands worked on, along with sometimes the hamstrings and maybe the calf muscles as
hiking
well.
guides.
Yes, and hiking guides. Yeah, perfect, because you're doing so much, stepping up, and then the descent actually requires more a different type of muscle strength, an eccentric type of strength on the descent, which actually requires more power from those leg muscles.
Yeah, it's definitely glutes versus quads, and your Achilles are in there and all that. You'd probably be horrified if you felt my IT band right now.
Oh yeah, is it?
Yeah.
Well, we can do that after.
I know.
I mean,
I know
I can get you in my schedule today, Alan.
Yeah, listeners, she's tempted me hard, believe me. So as far as feelings afterwards, I think we've laid out well, like what the experience might look like. You're laying on a table, you've felt the muscular area that needs work, inserted the needle for a couple seconds, these tiny little needles, and then you take it out. Afterwards, what do you find that guests feel like? What is their experience? Are they coming back really quickly because they want it again or they need it again? Like,
everybody is unique.
Okay.
But typically, most people feel a fairly immediate release. Like, oh, wow, I feel looser. And for example, if someone's range of motion was decreased prior to the needling, I'll recheck it afterwards. Most of the time, you're seeing an improvement in range of motion. For example,
That's really cool.
like turning your head. Okay, someone may come in feeling like, oh, I woke up with a kink in my neck, right? That's like a real common one. And boy, you release those muscles and all of a sudden you can move your head. But it's not always like that. I don't want people to expect, just instant. But often it only takes 1 or 2 sessions to see some significant changes.
Gotcha. And how long is a session? I don't think I asked that. Like the whole process, how long does it take?
Well, dry needling itself, it usually only takes a few minutes.
Okay.
However, remember that is only one of the tools I use.
Sure.
So typically I'm seeing guests for an hour.
Yeah.
A follow-up visit might be 30 minutes.
Yeah.
And you can needle an awful lot.
Yeah, I'm sure.
in 30 minutes or an hour, right?
Yeah.
More than what people are typically that would be appropriate, right?
Yeah.
So we're using other things, like I may be using manual therapy or cold laser or, exercise prescription. There's all other parts to helping move a person forward in their health journey.
Yeah. And we might do some other, topics on some of those other things. But so it sounds like maybe once, maybe twice is what somebody might need out of a dry needling
Yes,
experience?
and obviously we're in a unique situation here. Now, if a guest is staying for a few weeks, wonderful.
Yeah,
Then
absolutely.
then if they so choose, I can see them,
A couple of times.
for over the course of a few weeks,
Mm-hmm.
for several times. But for someone staying a week, we're usually trying to get in two. If possible,
Yeah.
but again, sometimes one is all you need.
Yeah. Would you say that dry needling is one of those things that you should keep coming back for? Or is it one of those things where if it's not helping after a couple of sessions, you should look somewhere at something else for some other help?
Yes, with the needling, I usually say, give it a fair chance a couple times. If you're not feeling like you're getting results after a couple times, then let's go a different
Okay.
route. And any sort of healthcare should be, you know, you should view things that way. You should
Yeah.
constantly be evaluating someone's response to whatever treatment their body's receiving.
Yeah. I asked that only because the one time that I had it done on myself, the physical therapist who helped me out basically said if a PT is telling you to come back over and over
Mm-hmm.
and over and doing the same thing,
Mm-hmm.
you should maybe think about that.
Right.
Yeah.
And I concur.
Yeah, I figured you would. So when I had my session with him that time, he hooked up electrodes to
Mhm.
my dry needle.
Mhm.
Is that common? Is that something? Because we hadn't talked about that yet. Is that something that you do?
I can do it.
Okay.
I have done it in
Yeah.
different settings.
Okay.
In Again, when you do that, it's basically a deeper form of electrical stimulation. You're using a needle to move that electrical current deeper in the body
Gotcha.
than you would with the silicone electrodes on top of the body. However, that requires, having the guest, lay on the table, just lay there with not an active treatment. That would be a passive treatment, for 15 or 20 minutes.
Mm-hmm.
Because my goal is to provide everything I can in that session
Yeah.
time.
Sure.
I am not typically doing that
Understood.
because a lot of that you can achieve close to that, like on your own with a TENS unit.
What is that?
A TENS unit is a little electrical device. You can get one on Amazon. Years ago they were like $700 or $800. Now you can actually get a decent one for like $45.
Wow.
But it provides electrical stimulation. It's an electrical current, and that is to help with pain and tightness.
Understood. Yeah.
Mhm.
I was just curious.
Right. Yeah. So, I have all the equipment for it. I have done it before, but like I said, in a different setting, because I think that in this setting here at Skyterra, expectations are high, as they should be. And I don't do passive treatments
Understood.
in this setting.
Yeah, absolutely. What as far as the person that has left a dry needling session, are they experiencing any bruising or soreness from the experience?
It's possible.
Yeah.
You can that's one of the potential adverse effects that I would mention to someone. Typically, if someone's on blood thinners, we have to be more cautious,
okay.
because you're more likely to bruise. But usually these are minimal.
Yeah. Is there anything else you want listeners to know about dry needling and its benefits?
I would say give it a try. Most people could really benefit, and you deserve to get a break from your pain and tightness.
Yeah.
And it can be a very effective technique. And don't let the word needle scare
Sure.
you. I love that we have this technique that we can get straight to the source of pain, tightness, and many types of referred pains as well can come from trigger points. So give it a try.
If somebody is like, yeah, I think that I have something that dry needling could benefit, what should they do? Obviously, we would love for them to come see you. You're the professional. What should they be looking out for if they can't come see you?
Well, in your hometown,
Yeah.
you can look for a physical therapy office because it's PTs that do this. I would suggest that you make sure that you are scheduled consistently with the same person.
Yeah.
And remember that this should be an active treatment. You should not be laying in a room by yourself for 45 minutes.
Okay. That's a great tip.
Yeah.
That's a great tip. I also see here in our notes, you can't do this yourself
No.
on yourself.
No, this is one thing that you really do need that licensed professional with special training to do on your body.
And that's why we have you.
Well, thank you for having me.
Absolutely. It's a pleasure having you. I can personally say I've heard several guests talk about their experiences with you and the classwork that you do. You teach some great lectures here as well, and give a very nice perspective, just as you did on this podcast, about everything that you do, not just dry needling. So one thing that Dr. Becky didn't mention is that she's also been an educator as well. And so that's no surprise that your lectures are awesome.
Oh, well, thank you so much.
Yeah, absolutely. So listeners, if you have any questions for us, you know what our email is, inspiredintentions@skyterrawellness.com. You can send me a message that I can get to whoever it needs to. We can ask Dr. Becky any questions. If you have them, we'll answer them either in the email or right on this podcast. Dr. Becky, again, thanks for coming on here, and I look forward to chit-chatting and figuring out what our next episode could be.
Thank you, and I really would like to get my hands on that IT band.
I think we'll start with the neck. That's probably...
Okay. Yeah, we can address the migraines for sure. That would be most important.
Yeah, for sure, for me. All right, well, thank you so much again, and listeners, we'll catch you again later.
Thank you, Alan.
The Inspired Intentions podcast is a production of Skyterra Wellness Retreat. Special thanks to our executive producer, Alan Broyhill. Send us your questions and comments to inspiredintentions@skyterrawellness.com. Subscribe on iTunes and everywhere podcasts can be found. If someone you know might benefit from this podcast, share Inspired Intentions with them and give us a 5-star rating. Join us next week as we cut through the unrealistic noise on diets and fitness and show you how healthy living fits seamlessly into your already busy life. Thanks for listening.